There's a gap between what we call primary service and secondary services, and our aim is to meet the person's need within the community where they are. We look at the patient holistically, not just part of the physical health alone. We look at what could impact them physically, socially, mentally, and everything, and we can encompass all that with the patient to ensure that their needs are being met.
Our team's growing really quickly, and there are lots of new roles in it that are helping support what we're trying to do, as well as the existing GP services.
Working within the crisis team, we had a lot of referrals from GPs. However, when we screened the referrals, they weren't really as crisis, but knowing that if there was a mental health nurse within the GP surgery, some of the referrals would have been avoided.
It's a great opportunity really to be able to work patient-focused and look at the patient as a whole and really provide person-centred care. It's exciting because it's a new role and you can help build it into what you think would help the most.
I think just the fact that we are so forward-looking and willing to work with the mental health services in secondary care to try and sort of forge stronger links and improve things for our patients is probably what's going to set us apart.
All of the team are really keen to focus on the patient's best interests. They're sort of really pushing that. We're looking at people holistically, and we've kind of got a bit more access to do things that is a bit more informal maybe.
It's one of the biggest PCNs in the area, so we've got 85,000 patients. We've also got 17 care homes, so I mean there's a lot of work to do.
The autonomy is a really great part of it because it feels as though I can do a little bit more for patients than I might have been able to do in previous roles.
By the very nature of the primary care network being a new entity, there's a lot of scope for just setting up the role and doing the things you want to do and establishing a lot of things yourself, which I found really fantastic to have that autonomy and just the ability to sort of create something new.
We have time to give to patients that busy general practice doesn't, so we can really spend time with people understanding what their needs and their issues are and helping them through that. And I think through that we're beginning to uncover a lot of need that perhaps was hidden. We're doing really innovative stuff and making a difference, and it's something new. So if you're up for a challenge, it's not necessarily always defined, it's sort of a bit make it up as you go along sometimes, but we work together as a team to get through that, it's just a really great place to work.
They're lovely, they are so motivated. They really want to play their part, make a difference, improve the patient's journey. They've got the opportunities sitting outside of practice to offer more than the sort of standard 10-minute appointments. So they can really take the time to get to know the patients and support them and sort of make sure that they get the care that they need. They're a great group of staff, they work really well together.
Call me and ask. I mean, the team will be very happy to offer time to come and shadow and spend one-to-one, seeing how it works on the day, but keeping very much in mind, if you've got a vision, then we want to know what that is, because we don't have all the answers, and it will be about kind of having that discussion and saying, well, what is it that you want out of this job?